Hi guys, this is Sri here, and we are now going through a rapid review of histology of the lung. Now this is the lung. The lung is defined as the lower respiratory tract, where the air passes before it gets into the lung from the nose into the lung, and this is the upper respiratory tract. So you see the lung has air spaces and vascular spaces. These spaces filled with blood, like here, are the vascular spaces. They grow from a pretty thick sized pulmonary artery down to smaller arterial branches, and the veins have thinner walls. Remember that the pulmonary artery system has a lower arterial pressure, so the arteries are not as strong as you expect them to be. When we look at the alveoli, you can actually see the smaller vascular spaces here. These are made of capillaries, and the air spaces consist of bronchi, bronchioles, respiratory bronchioles, alveolar ducts, and alveoli. They go from the larger to the smaller structures respectively. If you see an airflow structure here that has cartilage as part of its wall, like you see here, you can see this is a bronchus. If you see an airflow structure that does not have cartilage in its wall, and you will find one pretty soon, here there's cartilage, so this is a bronchus. Here there's an airflow structure where there's no cartilage, so you call it a bronchiole. The difference between a bronchus and a bronchiole is whether there's cartilage in the wall or not. Now, go to the lowest level of air spaces, such as here, all this. These are the alveoli. Now, majority of the cut section of the lung will show alveoli. Now, see this area where there is a common vestibule of group of alveoli. This is an alveolar duct. The middle portion between the bronchiole and an alveolar duct is a respiratory bronchiole, which are actually sometimes hard to find, and I wouldn't want to waste my time doing it here. But it is a respiratory bronchiole in which the normally ciliated columnar epithelium is present, and it becomes cuboidal and then squamous when it reaches the alveoli and the alveolar ducts actually. So let's just review this. This is a bronchus because there's cartilage, and this is the normal columnar ciliated epithelium. This is the lamina propria. This is the fat area. This is the submucosa. The cartilage would be the adventitia. This is the bronchiole because you don't see cartilage, and this is also filled, this is basically lined with an epithelium here, like in the bronchus. As we zoom to a higher power, you can see that this is columnar pseudostratified epithelium and ciliated. You can't see the cilia very clearly here. We'll wait for some more time and zoom in later. These are the alveoli, the wall of an alveolus. Look at the red areas in the alveoli. These are the capillaries. Otherwise, the wall of the alveolus actually consists of pneumocytes. There are two types of pneumocytes, type 1 and type 2, and also occasional macrophages. Now let's see if we can find some of these cells. Now a type 1 pneumocyte is actually a small spindle-shaped cell which is present along the wall of the capillary. Now, if you see a pneumocyte that looks a little foamy like this, or here, or here, or here, this looks like a mesothelial cell. These are type 2 pneumocytes. Now, in addition, you can also see cells like here. These are the Clara cells. Now, these have surfactant in the bronchioles. Actually, I don't see anything more here. Perhaps we'll just take another quick look and let's see. Well, I guess if you want to actually look at the very edge of the lung, you have to remember that this is the parietal area, the visceral pleura, and ultimately all the pleural or peritoneal or pericardial surfaces, they would involve having a single layer of cells. These are the mesothelial cells. Okay. Yeah, probably all this area is the mesothelium. It's probably not very clear because what I'm actually doing is an actual video recording over a virtual microscopy session, so it's difficult to identify, but we'll actually try to use a little bit of imagination as well. This could possibly be an area of the pneumocytes. Now these are all blood vessels. Okay, this is probably a vein because it has a very thin wall. But remember, the pulmonary arteries also have very thin walls because it's a low pressure system. I feel very, very comfortable saying right now that this was basically a good session. Thank you very much.